Hey everyone, ready for another deep dive?
Yeah.
This time we're tackling some pretty wild news in the world of weight loss meds.
Oh, yeah. This is a big one.
It all starts with the FDA, the Food and Drug Administration.
Right.
Well, they just declared that the semaglutide shortage is officially over.
Which, on the surface, sounds like great news, all right?
Exactly. But hold on, because there's a twist.
A big one.
This decision has some major implications.
Huge implications, actually, especially for companies offering those compounded versions of these drugs.
Like Hims and Hers, for example. Their stock took a massive hit.
On a nosedive.
I'm talking a 25% drop practically overnight.
Yeah.
So yeah, it's a fascinating situation.
Definitely fascinating.
I'm going to break it all down for you. What does it mean for patients, for the businesses involved, and what might happen next?
Lots to unpack.
We'll be looking at a couple of sources today,
Yeah, we've got some great info from Fierce Pharma.
and a really interesting YouTube video by MedPage.
It's amazing how these two sources offer totally different angles on this whole story. It really helps paint a more complete picture.
Definitely. Okay, so let's start with the basics. What exactly happened here?
Well, the FDA basically said, hey, the semaglutide shortage, it's over.
Semaglutide, that's the key ingredient in Ozempic and Wegovy, right?
That's right. Those are the big brand name drugs.
Okay, so the shortage is over. So what's the problem?
Well, here's the thing. This decision has huge GE implications for compounding pharmacies.
Because now they can't really make semaglutide anymore.
Pretty much, unless there's a specific patient need, like a serious allergy to something in the branded version.
I see. So that explains why companies like Hims and Hers are in a bit of a panic.
Hims and Hers, Ro, Noom, a lot of these telehealth companies were really thriving.
Because they were offering compounded semaglutide at a way lower price.
Way lower. We're talking maybe $200 a month.
Compared to over $1,000 for the brand name drugs.
Right, exactly. So you can see why this FDA announcement sent shockwaves through the market.
Yeah, a 25% stock drop is no joke. But this isn't just about business, is it?
Absolutely not. This is about people. Real people who rely on semaglutide to manage their weight and their health.
Right, millions of patients. So what happens to them now?
That's the big question, and frankly, it's a big concern.
So before we dive into those concerns, can we just clarify the difference between Ozempic and Wegovy again?
Sure, so they both contain semaglutide, but they're prescribed for different reasons. Ozempic is specifically for people with type 2 diabetes.
To help them manage their blood sugar levels, right?
Yep. Whereas Wegovy, that one is approved for weight loss.
And both can be super expensive.
Yeah, like we said, over $1,000 a month in some cases. And that's where compounded semaglutide came in. It gave people a more affordable option.
Right, so this FDA decision has potentially cut off access to that cheaper alternative.
Unfortunately, yeah. And that leaves patients with a really tough choice.
Go back to those pricey brand name drugs.
Yeah, maybe. But for a lot of people, that just isn't realistic. Financially, it's just not possible.
So what are their other options?
Well, some might try to cut back on their doses to make the medication last longer.
Which isn't really effective.
Not at all. It can also be dangerous to mess with the dosage like that.
And then there's the scariest option, the black market.
Unfortunately, yes. When people are desperate, they sometimes turn to risky alternatives.
Like counterfeit drugs.
Exactly. And those are a huge gamble. You just don't know what you're getting.
Could be ineffective. Could be contaminated.
It's terrifying, and it's a stark reminder that the FDA's decision, while aimed at solving one problem, might unintentionally lead to even more problems.
Like a domino effect. Wow. Okay, so we've got this issue of patients potentially being left in the lurch. But then there's also this conflicting information coming from different sources, right?
Yes. Like Novo Nordisk, the company that manufactures Ozempic and Wegovy.
What are they saying?
They're insisting that there's plenty of semaglutide available, that they're meeting demand.
But
But doctors on the ground are telling a different story.
they're saying they're still struggling to get semaglutide for their patients.
Yep. And it's not just anecdotal evidence either. The American Society of Health System Pharmacists, they still have semaglutide on their shortage list.
Along with another popular GLP-1 drug, tirzepatide. So who do you believe? It's all so confusing.
It really is. And this whole situation also brings up another important point.
About compounded medications themselves.
Yes. Now, they are legal, but
But there are concerns.
valid concerns, yeah. About quality control, about dosage accuracy.
Because they don't go through the same rigorous FDA approval process as those brand name drugs.
Exactly. And that's a point that was really driven home in that MedPage video.
The one about the increase in calls to poison centers.
That's the one. And those calls were often due to overdoses, many of which were linked to compounded semaglutide. In fact, they saw a 69% increase.
Wow, that's a huge jump.
It's scary. And it shows just how important it is to be careful with compounded medications, both for doctors prescribing them and for patients taking them.
Right. Getting the dosage right is absolutely crucial. And the FDA has even issued warnings about this.
They're urging doctors to be extra cautious when prescribing compounded semaglutide. And they're really emphasizing the importance of patients understanding those dosage instructions.
So it's this complicated balancing act, isn't it? We need to make these treatments affordable, but we also can't compromise on safety.
It's a tough spot to be in, and it really highlights the challenges within our healthcare system as a whole.
It's a tough one, for sure.
Yeah.
Affordability on one side, safety on the other.
Yeah.
And caught in the middle. Real people just trying to live healthier lives.
Exactly. This situation, it raises even bigger questions about the whole pharmaceutical industry, doesn't it? Like, why are these life-changing meds priced so high to begin with?
It's something a lot of people are asking, especially now.
Now with Robert F. Kennedy Jr. at the helm of HHS, the Department of Health and Human Services.
That's true. Kennedy, he's known for taking on big pharma. He's always pushing for lower drug prices.
He is. So it makes you wonder, could his stance on this actually influence how the FDA handles these compounded meds going forward?
That's a great question. It feels like this whole crackdown on compounded semaglutide is putting the spotlight on this issue.
The whole issue of drug pricing, yeah. And affordability. It's highlighting the struggle so many people face trying to access essential medications. And it really shines a light on the role that compounding plays, when those traditional routes are just too expensive.
But with those poison center calls, doesn't that show the FDA has a point? That they're right to be concerned about the safety of compounded drugs?
Oh, absolutely. It definitely underscores the need for caution, for oversight. But I think it also emphasizes the need for a more balanced approach, We need to protect patients, make sure things are safe, but we also need to tackle the root cause, that underlying reason why people are turning to compounded drugs in the first place.
Which is?
The high cost of those brand name medications.
Right. So it's not as simple as saying compounding is bad. Everyone can go back to the brand names.
Not at all. There are so many layers here. We have to think about the ripple effects.
Like what happens to the people who just can't afford those branded meds?
Exactly. Will they go without treatment? Potentially face even more health complications down the road.
This isn't just about individual health either, right?
Nope. This impacts the entire healthcare system. Think about it. If these meds stay super expensive and demand keeps rising,
Which it is.
will the system be able to handle it? We already hear about long wait times just to see a doctor who specializes in weight management.
It sounds like we need a whole new approach, something more comprehensive,
Yeah.
when it comes to weight loss and obesity treatment.
I agree, 100%. We need solutions that go beyond just popping a pill. We need to look at lifestyle factors, access to healthy food, mental health support. It's all connected.
And it all needs to be affordable, right?
Yes, affordable and accessible, no matter your income, no matter your zip code.
Otherwise, it's like we're saying only the wealthy deserve to be healthy.
That's exactly what it feels like. It's a matter of equity. Everyone deserves a chance at a healthy life. Access to effective treatment, it shouldn't be a luxury.
Well said. So where does this leave companies like Hims and Hers? They've hinted at finding legal ways to keep offering personalized semaglutide.
They have.
But with these new restrictions, how can they even do that?
That's the million-dollar question. It'll be interesting to see how this all plays out. And it's not just them. The Outsourcing Facilities Association?
No.
They're actually suing the FDA.
Really?
Yeah, over a very similar crackdown on compounded tirzepatide.
So this could be headed to court?
It very well could, which just adds another layer of uncertainty to the whole situation.
It does. But could there be another way? What if companies like Hims and Hers actually partnered with those big pharma companies
Interesting idea.
to offer more affordable options, maybe?
It's certainly a possibility, but it would require a lot of creativity, for sure, and a willingness to collaborate across those different parts of the healthcare industry.
And, of course, we can't forget the role of government and policymakers here.
Absolutely not. They have a huge role to play. The decisions they make in the coming months, even years.
About drug pricing, access to treatment.
Exactly. Those decisions, they will have a huge impact on the healthcare landscape as a whole and on the lives of so many individuals.
It really feels like we're at this crossroads, with these new weight loss medications. They have so much potential to change lives.
They do.
But that cost, it's like this giant question mark hanging over everything.
Yeah, it really makes you think. If these medications stay so expensive, can they really be the answer to the obesity epidemic?
It's almost like, are we saying that only the wealthy get to be healthy?
It's a valid point. And it brings us back to that need for a broader approach to obesity, right? It can't just be about medication.
Right, we have to think about lifestyle changes.
Absolutely.
Yeah,
Food insecurity, the stigma that surrounds weight, these are all part of the equation.
it's all connected.
It is. We need a more holistic view, one that considers the whole person.
So where do we go from here? For our listeners, what are the key takeaways from all of this? We've talked about the FDA's decision, the impact on companies like Hims and Hers,
Right, the concerns about compounded medications.
that whole issue of affordability, access to treatment.
It's a lot. I think the biggest takeaway is that this is a complex issue. There's no easy answer, no quick fix.
Definitely not.
But by understanding those different perspectives, the potential risks and benefits.
And how healthcare policy plays into all of this.
Exactly. That's how we can make informed decisions about our health and how we can push for change within the system itself.
It all starts with being an informed patient. Do your research, talk to your doctor. Don't be afraid to advocate for your own needs.
That's so important. And remember, everyone's health journey is unique. There's no one-size-fits-all approach.
Definitely not. It's about finding what works best for you. And sometimes that means being your own best advocate. So as we wrap up this deep dive, we want to leave you with something to consider. As this crackdown on compounded semaglutide continues, what does this mean for the future of affordable access to these medications? Will we see innovative solutions emerge? Or are we on a path towards even greater disparities in who can access treatment?
It's a big question, one we'll definitely be keeping an eye on. Thanks for joining us as we explored the world of semaglutide, compounded medications, and the complex landscape of weight loss treatment.
We hope you found it insightful, and we always encourage you to stay curious and informed. Until next time.